Good evening. I'm Dr. Jha, Director of Renewed Skin Health Clinic. This video is particularly made for the assistant to understand the importance of sterile field, unsterile field, and the way we touch the things and the way we don't touch the things. How the assistant should open one particular pack. If the assistant has to open this particular pack and give it to the surgeon, they have to carefully open this and drop it in the surgical field without touching anything. So it could be that, it could be that. This is a loop what we use in our surgery. So very carefully open and drop it safely that it falls in the sterile area. So in this video, what I'm going to do, I'll be the surgeon and Julia is my assistant. Hello Julia.
Hello.
So I'm going to sit down there, Julia, and please help me to set up the pack here. Thank you. Okay, here we go. I'll just have this. I'll just have that. Yeah, open it up, please. I will open it up. So you bring the other things. So this is a sterile pack. I'm going to open this and spread these papers, and this field is now sterile. If I have to touch it, I'll have to use it this way. Okay, Julia. Julia is dropping the gloves, as you see, without touching anything. This is the gloves, I'm going to wear it. Once I have got the gloves, my hands are sterile, and then I will not be touching anything. Okay, Julia, thank you. Thank you. The top part of this paper is sterile, as you understand. So I'll make few swabs to clean the patient's the part where we are going to operate.
What are you going to add there, Julia?
So this I use to, well, apply the area maybe with thigh, maybe arm, maybe leg, or maybe his penis. So I clean the area with this betadine and put it in somewhere which is unsterile. And then after this I need a fresh gloves because I need gloves now, as you see. So I throw these gloves away. Julia has got that fresh gloves now, so I'll take a fresh gloves and
Five ml syringe.
so she's given me a 5 ml syringe which I'm going to use for local anesthetic. There are some local anesthetic over there, which is 1% plain, 1% lignocaine. And Julia is also going to give me a blue needle and a yellow needle. So these are the blue needles. Just see how this looks. Yeah, that's good. Okay, so that's a yellow needle, and I usually inject with the yellow needle in the patient's body because this needle, as you see, the needle is very, very tiny and it hurts very less. And to draw up my drug, I use usually the blue needle with the syringe and bring it here. Now in this, there is a way to open this. There is a dot, the blue dot there, as you see. So you have to hold and push it against the blue dot, and that's how you break it. So I'm drawing up the local anesthetic injection, as you see. Julia is very carefully holding it and holding it with a steady hand. I will bring my come back again. So I need to fill up my syringe again, and so she can now discard that in the sharp bin because that is a sharp product. Okay. The needle is big, that's why I will use the yellow needle for the patient's body where I'm going to do the operation. This is a topper, which basically is a swab, a sterile swab. Just observe the way she is dropping it in a sterile field without touching it. Excellent, thank you. Now I also require my glasses when I'm doing the operation, and these are specialized loops. They magnify the area, and Julia has cleaned it up, and she'll remove my normal glass, and I'll have the loops now. Thank you. Yes, it's perfect. Slightly up, slightly up, slightly up. That's perfect. Now I can see very clearly. That's perfect. Now, in the radiosurgery, we use these two items. One, as you see, has a blunt end, what I call it, or we call it, the ball electrode. And this is a loop, we call it wired loop electrodes. So both are electrodes. So for PPP, I require generally the blunt one, and for removing moles, we generally require this. But sometimes after removing moles, if the area is bleeding, I might ask the assistant to give me this as well to stop the bleeding areas. Okay, now let's come here and let's explain this. If you switch it on, no, you have to switch on. So this is a radiosurgical equipment. As you see, this is a yellow in color, which says mono cutting, and the blue one is monocoagulation, and bipolar, which is cutting and coagulation both together. Yes, open it please. Now this one is Florida. This, if you saw the both ends, these are, as you see, sterile sheath for ultrasound sheath. This is the sheath what you use for the electrodes. Julia is opening. As you see, there's a plastic sheath here, and there are two rubber bands. These two rubber bands, which I will keep safely here, and this can be discarded. And now I have got this sterile sheath. Now you have to watch. We'll adjust that later on. Now these electrode hand pieces have got two colors. One is, as you see, yellow color, and other is blue. You have to ask me all the time which hand piece I'm going to use it, blue or yellow. Blue is used for cutting, and for PPP generally I use just the blue one. Okay. So today we'll just use the blue, blue one. Okay. So just to watch the way the Julia is doing it, I will give that end, free end, to Julia. This is the sterile end, which I am going to keep it in the sterile field. Thank you. And then I will fix this with the rubber band, because they are slightly bigger size. That's perfect. Now I have got two sterile papers here, which I'm going to place it here, and the other one. Now this area is sterile, so I can safely put them here. And I'll come back, complete my job, go back, and then I need the loops. Yes, this is other thing to know. This is a sterile, big sterile sheet with a hole inside. So again, don't open it. Again, Julia will open it in a way that it is sterile and it will drop here without touching anything. And then I will do the rest. But we don't require it because we are just doing a demonstration. That is in a nutshell. Sometimes assistant is required to give me the hand in the operation itself, and in that case they will have to put on the gloves before they help me in the operation. So the way I want them to wear the gloves, Julia, if you give me, okay, I've got here gloves, spare gloves, which I will demonstrate to them. Now, there is a technique to wear the gloves. Each gloves comes in this packet, these sterile ones. They usually marked right and left here, left R and L, but unfortunately this one does not have that, but that's how they generally come. So you open the pack like this, and then you see how I am wearing it and try to copy the way I wear it. Okay, so see that way, and now my hand is in sterile field and I'm trying to wear it without touching the tips. So that is how I want you to put on gloves if you do have to. So that is all in a nutshell. I will just go through some other equipment that we use, that you, the assistant or the person who is assisting me should understand what I'm talking about. So this is a Proline, that is Vicryl. The Vicryl generally comes in that purple blue color, and the light blue is Proline. Now each one of them, you see they're numbered 20, 30, 40. They may come in 50, 60 and so on. So the assistant will have to take one of these out and then drop it in the same way as Julia demonstrated. So they've got a peeling thing that you can peel and safely drop into the sterile field. Thank you. That is a minor surgical pack. It has got the minor surgical equipment in there. They feel slightly heavier than the other pack which Julia opened right in the beginning. Okay. There are some other equipments. These are normal salt, the normal salt saline, which Julia gave me right in the beginning in that blue pot there. This is betadine, this is iodine cleaning solution, and this is a Dermablend. Sometimes we do use Dermablend before we start the radiosurgical procedure, just to shave off the mole for biopsy purpose. Once we have shaved it off, we can put it in this container, and I will obviously fill in at the end before we send to the laboratories. So that is in a nutshell. That's how I like my assistant to help me.
Expiration date.
Okay, yes, the other thing I would like you to understand that each of these products, they have got a validity life. If you look at any pot, anything, they also will say here when they were manufactured, when they're going to expire. Everything has got a date there. So like for example this one, it says expiry 2015. So everything has got expiry date. Like this pot, you have to carefully look. When is the expiry date? Yes, it says 2014 February. So it is assistant's job to check each item which is going to be used in the surgery, whether they are expired, they are dead, or they are alive, and they have got a valid date. Okay, thank you very much.